Hello, today is November 26, 2019. This is my patient. Her patient ID number is 1234. Her age is 30-year-old female. She is presenting for a nutritional counseling session. So thank you for coming and partaking in the 3-day food diary and printing it off and bringing them. She has no chief complaint, no medical or dental concerns, and the EO-IO came back all within normal limits. Her perio class is class 2, and she has less than 15% for a plaque index today. When we did her Canberra, she ended up to be a moderate Canberra caries class. She has had a carious lesion within the past 7 to 23 months. Looking at her food diaries, her sugar intake for the past 3 days, the one day was a little bit higher than your other 2 days, and it shows that you had some of your hidden sugars was in the Korean barbecue chicken, and that was at 22 grams of sugar. So if you could maybe cut down your barbecue sauce a little bit, that might help with some of the sugars added in. You also had Burger King cheeseburger, and that was 7 grams of sugar, which in the grand scheme of that day wasn't a whole lot. So you got your majority of sugar there. And then on the 3rd day, it looks like you also had a Burger King croissant sandwich, and that was at 4 grams. So your daily sugar intake really isn't that much, except for this one day where it was at 43 grams. And the majority of it, like I said, was in that Korean barbecue chicken. So maybe substituting, just doing plain chicken breast versus barbecue chicken, that might help your bring down your sugar intake. Some things that help cause caries is the microorganisms, your cariogenic diet, and salivary factors, along with the resistance of your tooth. So if you have all of these factors, you are more likely and more susceptible to get caries or cavities. We can control our cariogenic diet, and sometimes your salivary flow just depends on either if you're on medications or not. Something that you can help with that is rinsing with water after meals, or chewing xylitol gum after meals for about 20 minutes will help cut down the caries activity in your mouth. So I just took and I circled some of the sugars that you had, some of the hidden sugars. Things that you can eat or do to help with this is eating more fibrous foods like carrots or broccoli. Stay away from the soft, sticky stuff like the gummies that stick to your teeth. But it doesn't look like you eat a whole lot of that in your diet, so that's good. So thank you for coming and partaking in this.